Hi, my name is Dr. Shahzadi Harper and I'm a GP specialising in women's health and well-being. I believe in holistic care for women during the perimenopause and menopause. My clinic is a perimenopause and menopause clinic, so it's all about women's well-being, and I would say that 7 out of 10 women that I see are affected in some way by bladder leakage. I would even go as far as to say almost all women will admit to some form of incontinence, but then I do ask them specifically, whereas other doctors may not ask. Women are much more aware of stress bladder leakage, which is when they're coughing, sneezing, laughing or jumping. Many of the women I see are probably less aware of what I as a doctor would call urge incontinence. It's that feeling of sitting in a meeting and being desperate to go to the loo. Often a woman just can't get away from the fact that she needs to go. Many women will say they have to get up in the night and go to the toilet, when perhaps this never used to be an issue for them, or they recognise they need to go to the toilet more frequently throughout the day or when they're out for dinner or meeting friends. The reason for urge incontinence is often linked to the menopause. This can often be due to hormonal fluctuations, and in particular changing levels of the hormone estrogen, which is responsible for maintaining the elasticity of muscles, including the pelvic floor. So when levels of estrogen drop during the menopause transition, so does that elasticity, which in turn reduces the support for the bladder and causes the sensitive nerve endings at the base of the bladder to send signals to our brain more frequently to say that we need to go to the toilet. There is often a misconception amongst women that if they've had a caesarean section or they've not had children, then their pelvic floor is going to remain supported and not lose elasticity. While they may be less at risk, the effects of the menopause, chronic coughing, and even constipation can still cause problems. Women are told by their doctors to go and do their pelvic floor exercises and are given a sheet to go away and practice at home. They rarely get access to a pelvic floor physio, which could help tremendously. Pelvic floor exercises are much harder than you think, and women can often find it difficult in recognising the right muscles. Many women will go off and buy incontinence pads because they're unaware of what else they can do. Incontinence makes women feel less feminine and sexual. Generally, I think women find it quite difficult to do pelvic floor exercises, and even I did when I tried them myself. I think Pelviva is truly innovative. I like the fact that you don't have to think too much about what you're doing, and it just targets pelvic floor muscles directly. I've tried Pelviva myself. I felt the difference after using just 3. I could feel my pelvic floor was stronger. Pelvic floor exercises should be a natural part of every woman's routine, just as we exercise other parts of our body.